I'm Dr. Karia. My practice was an early adopter of negative pressure wound therapy. We had heard about the idea of placing black sponge on incisions. It was a little bit intense because you have to put plastic tape down around the edges, then put the black sponge, and then get it to seal. After doing that for a while, we did also notice that the wound edges, no matter how good you were with the plastic tape, tended to macerate a little bit. When Prevena came out, we saw the anti-wicking layer and decided to try it. Prevena Therapy was much easier to apply than what we were used to. When we look at high-risk patients that we're considering Prevena Therapy on, we just divide it into two categories. One are patient factors that we cannot control. Diabetes, smoking, kidney disease, and liver disease are some of the most common ones. The second group are incisions that are problematic. These are either incisions in an area that we think are high risk for contamination, or incisions that have undergone so much trauma that we think that they're high risk for complications like dehiscence and infection. So when I have acute injuries that are high energy and have a lot of soft tissue damage, we like to use Prevena Therapy because it decreases our risk of surgical site complications while also helping to decrease surrounding soft tissue edema. In my hip population, I like to use Prevena Therapy because it helps isolate the wounds from nearby contaminated body sources. Lastly, when we're doing deformity work, the skin is oftentimes under tension when we're going to close. The Prevena Therapy helps decompress that tension. Even before you take Prevena Therapy off, patients often feel that their leg, their arm is splinted. They get some sort of stability or support from that dressing. When they take it off, oftentimes they're impressed on how much less the swelling is underneath the dressing compared to the remainder of the soft tissue. Prevena Therapy is very portable. The canisters are small, and they often have devices where you can hook it onto your belt. Prevena Therapy was peel in place. It was so much easier, and it just made the entire end of the surgery better, more efficient. If you're gonna try it, make sure you're present when that dressing comes down the first time, just to see the difference in what that tissue looks like compared to what you're used to, but also what that tissue looks like in comparison to the surrounding soft tissue. Prevena Therapy helps to protect the incision.